Well, like all relationships, the one between a doctor and a patient is based on mutual respect and, most importantly, trust.
That's right. And here to share some insight on the dangerous mistakes you're making at the Dermatologist is cosmetic dermatologist Dr. Doris Day. Welcome.
Thanks for having me.
So you're saying basically just be honest, right? Why do people hide things from their doctors, do you think?
I think sometimes it's not really that they're intentionally hiding. I think sometimes they're just scared when they go in and they have so much they want to cover and so much they want to say that they don't get to everything.
Right.
But it is important to share everything with your doctor. And I think a good way to start is to write it down at home.
Yeah. I've heard doctors talk about the doorknob question. The question you get as you're a doctor, you turn to leave, your hand hits the doorknob, and they finally summon the courage to ask you the thing that they really want to ask you. Do you think people are afraid that you might be delivering bad news to them if they ask about this thing, and that causes some hesitation?
I think you're exactly right. A lot of times I know that when patients come in with one concern, there's really something much deeper behind it that they're afraid of. So they may show me a rash, but they're afraid that maybe they had unprotected sex the night before and now it's a sign of an STD or HIV or something really big, and they're just too embarrassed to either confess and they feel guilty about what they did, or they don't want to hear the news that it might be something bad.
Let's go on the flip side now. Some patients, I'm imagining, would come to you and say, I want to look perfect. Is there such a thing as that?
Well, I think perfect is very special and it's unique. So perfect for you may not be that I tell patients all the time, look, I can get rid of every line and wrinkle. Doesn't mean you're going to look better. So you have your own special beauty, and my job is to celebrate it and enhance it, not to change how you look to this generic perfect. Because one is, that doesn't really exist. But I will tell you that beauty is somewhat mathematical. And as an aesthetic dermatologist, I do study the mathematics of proportion and balance. And when I, in a very subtle way, add in balance in places you don't expect, sometimes it's the temples or the lateral face or lateral cheeks, not always chasing lines and wrinkles where you think you see them, but understanding where they come from, I can have a very powerful impact in making someone look better without changing how they look. And no one should know I was there. That's the real beauty, is when you look just like you. But the best version.
Yeah, you
the
just
best
look
version
a little rested
of yourself.
Yeah.
But I think one of the big mistakes people make as well is that they mistake aging gracefully with aging helplessly. They think if they do anything to look better, like a filler or a treatment or something in the office, they think that they've crossed a line and now all of a sudden it's artificial, when it's really not. These, when done properly, are FDA-approved procedures that can really bring out and enhance your own beauty without changing how you look. And I think it's understanding that balance, that we have technology that can help us age truly gracefully and look beautiful, and that it's okay to do that. It's okay to feel your best and look your best. Women often feel guilty about that, and they feel like they should be doing for everyone else, and it should never be about them. Or how smart can I be if I look this good? You know, it's like silly things. So I really try to help women understand that by looking your best, you often feel your best, you make better decisions, and that has so much to do with self-esteem.
What are some of the biggest mistakes people make when it comes to caring for their skin, especially as we age? You see a lot of different conditions in your practice, from rosacea to adult acne. What are some of the misconceptions?
I think one of the biggest ones is thinking that, you know, I've had so much sun exposure, what difference does it make how much I get now? You get most of your sun exposure as a kid, and that's just not true. No matter how much sun exposure you have had in the past, no matter how old you are, it's never too late. And if you just use sunscreen every day, your skin will repair some damage, will age better, and will look better and have lower risk of skin cancer. So sunscreen every day, all year round, is really important. It's never too late to start taking care of your skin.
Can you overtreat also? Is there such a thing? I mean, I know a lot of people, there's the addictions. I've heard of addictions to Botox and things like that. Does it actually exist?
Yeah, sadly, you know, some people don't see how good they look. They only see flaws. And every time they look in the mirror, they just find something wrong with themselves. And it's such a pity. So I always make people look and say something nice when they first look in the mirror, because I think that's really important. And people will say, oh, I have lines, I have deep under eye, and they keep trying to fill. But in their mind, they're not seeing themselves in an accurate way. So as the aesthetic physician, the job is to help patients see themselves in a more accurate, beautiful way, and not always try to chase this image that they have in their mind. Right. That's so important.
People try things at home, obviously, often before they come to a dermatologist.
Yes.
Do you see people who go overboard at home?
Yes.
And then they show up and you're stuck doing some fixing, I assume.
Exactly. And that speaks to the overdoing things as well. People think if a little is good, a lot is better. So they'll buy so many different products at once. They'll go on this rampage and they'll just try so many new things. And of course, they'll have an irritant or an allergic reaction to something, and then we have to kind of walk it back. Another thing is that if you're going to have a treatment or procedure, it is really important to let your doctor know if you have things like cold sores or rosacea or any other skin conditions, psoriasis or eczema, because sometimes treatments can make those come out, can be a trigger for those. And if you don't pre-medicate properly, you can have a big problem. So make a list of things that you have sometimes that you may not think of while you're in the doctor's office when you're nervous.
Good information. Dr. Ned, thank you so much.
Thanks for having me.
Appreciate having you here. We will be right back.